Hey y'all, this is Miss Kagome and I am 32 plus weeks pregnant. The status of cholestasis has not changed. I went to the doctor yesterday and I did tell the nurse practitioner that I've been itching a lot more. I am on Ursidol, the highest dosage, I guess, 300 milligrams 3 times a day, and I've started itching. Before the itching did stop when I first started taking the Ursidol, I found out also that my bile salts had gone from 16 to 26, and that was a few weeks ago, and they haven't tested them since. Um, so I asked if they were gonna test them, and the nurse was more like, "It doesn't matter if we test them or not. You already have the diagnosis, and you're gonna get induced at 37 weeks." And it was kind of like, haha, it doesn't really matter, which kind of concerned me a little bit because I know that it can get worse and it can go higher. And I've heard of women losing their babies before their induction date. So I'm a bit worried about that. I don't even have to go back for 2 weeks. I was going every week for some reason. And then I saw a nurse practitioner and she scheduled it out for 2 weeks. But I requested that I see my doctor the next time I go in. So I'll be doing that. What else has been going on? I had my first non-stress test yesterday, which turned out really good. He was asleep. So they woke him up and got his heart rate to go up and everything so they can take a look at it and make sure it was doing what it was supposed to be doing. I didn't have any contractions during the test. So that was good too. So I had that done. Everything turned out fine with that. I have to do that once a week now, so I have to go back next week and do it again. Um, what else? I'm going to the oncologist on Monday because everybody's been bugging me to do that. So I found an oncologist here at the Rex Hospital. So I'll be doing that. I'm supposed to go to Chapel Hill on the 30th and get the um the testing for the genetic testing for cancers and stuff like that, since I have a history of breast cancer. Blood pressure's been doing good, even though they got me on like high risk for preeclampsia. Um, the last child I had was 12 years ago. I developed preeclampsia when I went to labor. I didn't get it anytime before uh labor or anything like that, but I did. I'm pretty sure I did have the cholestasis. I think that's how you pronounce it. Cholestasis of pregnancy, the first pregnancy, and didn't know what it was. So, um, last ultrasound I had, the baby was almost 3 pounds. That was maybe 3 weeks ago, 2.5, 3 weeks ago. So, he's the right weight. He's growing. Placenta is good, and everything's looking good. I saw a lactation specialist recently who told me that there was a big chance I would be able to produce milk because of the type of um, breast reduction I had on the left breast. I can't use my right breast to breastfeed at all because it's not real. There's nothing about it that's real. It's just an implant and a muscle, so I can't use that one at all. It has a fake nipple and all that, but I still have my nipple on my left breast, and I had, like, I guess it's called like an anchor um, reduction. So they didn't just like remove my whole nipple, sit it on the table, and then sew it back on. They like moved it up, so I might have enough ducts and everything in there to get some milk. So, but if not, I'll be able to bottle feed as long as the baby gets fed. That's what's important. Um, Still been sick, still been tired, been itchy. My feet are swelling. I think my feet grew. I went to the store to try to get some shoes, and none of the shoes would fit in my size. Even went up a size bigger, and they were like fitting weird. So I didn't get new shoes. So I'm thinking and praying, hopefully, that my feet will shrink after the baby comes. The nurse practitioner was asking me about birth control. I told her I wasn't gonna use any of the pills and stuff like that. And she's like, "Oh, you can use this and we can insert this." And I'm like, "No, I don't want any of that." As soon as I start using birth control and stuff, I start itching again, and I don't want to use anything that I cannot take out of myself. Because I know with pills and things like that, I can just stop it. Even if you get like that shot after 3 months, you can just like not do it anymore. If you feel like it's not doing you good and if it's harming you. But she was sounding pretty adamant about wanting me to have birth control. And I was like, look, my son is 12. I haven't had any kids all this time. I think I'll be okay. And for some reason, I think that she thinks I'm single or something. I guess because my husband wasn't there that day. Like a lot of appointments I've been to, the doctors think I'm a single parent in there. But whatever, I don't know. He's been in training and stuff. So, yeah, that's that. But let's see. That's pretty much it for the update. I guess I can give you a belly shot. I have lost weight. I haven't been gaining any weight at all. But the doctor doesn't seem concerned. My belly's not like huge for what it would be on some women. But I'll show you anyway. Let's see if I can show you from here. I'm going to pull my shirt up. You can't see. I'm going to stand up. Let's put this down. Okay. $32. So my maternity pants. I'm not like all belly or anything, so you know, big enough for one baby though. You ask me. This is just a bruise from the belt buckle I used to wear. I don't wear them anymore. So yeah. So that's the belly. Besides that, everything's pretty much going to plan. And I'm gonna just keep praying that everything keeps working out the way it has been. Maybe the itching will go away because that stuff, it ain't no joke. And I don't want the baby to be harmed. So hopefully it'll get better. If you have any questions or statements, just comment below and I'll get back to you as soon as I can. Okay, bye.